Okay, and exhale, extend out.
When you see Teresita working out, it's hard to imagine that a short time ago she was living with a serious heart problem known as atrial fibrillation.
Oh, it's just very, very disconcerting. It's just very frightful. Your heart starts to beat totally out of control, and you don't know what's going on.
Like Teresita, more than 2 million people in this country suffer from atrial fibrillation, the most common of all disturbances in the normal heart rhythm.
Well, the most common complaints are shortness of breath and palpitations related to lack of stamina, and the most severe symptoms can be related to heart failure, lack of ability to perform any daily activities, as well as increased risk of thromboembolic event and strokes.
Atrial fibrillation can sometimes be treated with medicine.
I was only on medication, but the medication wasn't controlling it. It wasn't controlling it, period.
But for many people like Teresita, medical treatment doesn't work. In some cases, then, a non-surgical ablation is the next step. Ablation is not an effective alternative for all patients, and for some patients, the relief is not permanent. For these patients, there is hope at the Inova Heart and Vascular Institute, where surgeons are performing the minimally invasive maze procedure.
It's very simple today. It can be done through a very small incision. The basics concepts of the procedure are to enable us to perform a three-dimensional maze.
During the procedure, a maze is created by forming scar tissue on the heart, which forces the electrical pathway in the correct direction. This returns the heart to sinus rhythm, or a normal heartbeat. At the Inova Heart and Vascular Institute, this surgery has a success rate of over 90%.
I have really no limitations. My doctors tell me that I have no limitations. It was the right procedure for me to stop it completely, right there and then, no more fibrillation.